Hi, today we'll talk a bit more about the ill effects of excessive intake of salt, and also we'll deal with values with reference to hypertension. And so we'll proceed with the verse first, and it's a small verse, I won't take much of your time. Khalati palita trishna atapa murja visarpa shvetu kiripa kota akshepaka asra pittam Shadavishamadattim Vadarektam Karoti Kshapyati Palamojaha So Adiva Sevanena. That means if excess intake or if there is excess intake of levanoresa or salt taste in the body, it leads to the aggravation of pitta and kabha. And what are they going to do in an aggravated state? They lead to all sorts of skin complaints, and pitta is nothing but rise of heat in the body, and as a result there is a like baldness, a loss of hair or a graying of hair, and all skin complaints. And because of excess kabha, there is a fluid accumulation in the body, and it can lead to hypertension and its bitter consequences. So now about hypertension. To come to the diagnosis of hypertension, normal blood pressure value is 120/80 millimeters of mercury, and if it rises to greater than 140 or systolic blood pressure 140 or diastolic greater than 90 millimeters of mercury, we call it hypertension, provided we get these elevated values for more than for 3 occasions separated by time. That is, not on a day we are taking the 3 measurements, but at intervals. And so on 3 occasions an elevated level of blood pressure greater than 140 millimeters of mercury with systolic or diastolic greater than 90 millimeters of mercury, we can come to the conclusion that the person is hypertensive. Stage 1 hypertension. And if supposing if the BP exceeds to greater than systolic greater than 160 millimeters of mercury or diastolic greater than 100 millimeters of mercury, we say that the person is in stage 2. Did I say diabetes mellitus? Sorry. It is stage 2 hypertension. And there is also a condition known as a hypertensive emergency, because excessive blood pressure can lead to end organ damage with reference to any organ in the body, mainly renals, and it targets heart, and also stroke can happen. And so it is like one should understand that a BP level greater than 180 millimeters of mercury or systolic and diastolic greater than 110 millimeters of mercury is a serious it's a life-threatening situation, and management should be begun at the earliest. And so the causes for hypertension, 95% of people, the hypertension is the primary, in the sense there is no specific cause for that, and the secondary causes are just in 5% of people, and it can be because of Cushing's syndrome or Cohen's syndrome, or due to coarctation of aorta, or those who are on oral contraceptive pills, they are at risk of getting hypertension. And also it is associated with stenosis of renal arteries. So, and if we find that a person is hypertensive, immediately we have to carry out certain tests, and they are urine analysis and blood urea nitrogen and creatinine ratio, to check that if any damage has happened to our organs, and we have to get the EKG done. Also that diabetic screening has to be done, and lipid profile we have to look into that also, so that the hypertension doesn't worsen the situation, and it doesn't lead to the so-called lifestyle disorders. And for that there's a bit of knowledge of salt and what happens, what is the action of salt and what the salt does in the body. Understanding all this is essential. That is why we are here. Okay, thank you.